Hello, I am Dr. Manish Shah, and today I would like to speak to you about what care one needs to take to avoid becoming blind due to glaucoma. The first step is that glaucoma is best treated when it is diagnosed early. As we know very well, in the early stages, very often glaucoma is symptomless. There is no way a patient would know by himself, in most cases, that he has already started developing glaucoma. At this stage, the diagnosis can be made by a routine eye examination by a qualified person. So the first step is to get diagnosed in time, and that only can be done if you have a regular eye checkup. Once you know you have glaucoma, the treatment needs to start. But before the treatment needs to start, one needs to know whether your glaucoma is the open angle variety or the angle closure variety. In the angle closure variety, the International Glaucoma Society advises that the first step should be what we call a laser iridotomy. The laser iridotomy in angle closure helps in treating the glaucoma more adequately in the long run. It has to be the first step, whereas in open angle, the first step is usually to start with eye drops. Once the doctor has advised eye drops and the treatment is started, the patient needs to take the treatment exactly as advised by the doctor. So that is step number 2. Take your treatment correctly as advised by your doctor. Step number 3 is the periodic eye checkups. The doctor needs to see you and do tests like visual field test, the optic nerve scan, intraocular pressure test at intervals. Only then he can be sure and assure you that your glaucoma is appropriately controlled. So step 2 is to take tests and go for regular eye checkups. Step 3 is to maintain records of these eye checkups and tests appropriately for future reference. The fourth step is to manage your lifestyle. This is very important, and no, it is not to do with TV screens and computer screens and mobile screens. What you need to take care in your lifestyle is have some regular exercise. If you are diabetic, keep your sugars well controlled. If you are having blood pressure, control your blood pressure adequately. And avoid certain stressful poses in yoga. You can ask your doctor about that. And avoid taking a very large intake of water at one time. These are very simple steps which you can take to keep your glaucoma controlled. But foremost to remember is that glaucoma is a lifetime disease. Whatever is done, whether it is drops or surgery or laser, glaucoma never goes away. So whatever you do, you have to be persistent, taking your treatment, going for tests, and keeping a watch on the glaucoma. If you do this appropriately, a very large percentage of patients can continue enjoying good vision throughout their lifetime. Today, I would like to tell you what is the modality of treatment for glaucoma. As we know, glaucoma is not very common, but it is not uncommon as well. And if not treated appropriately, it is a potentially blinding condition. The blindness which comes due to glaucoma is unfortunately not reversible, even by the advanced modern science that we have today. So appropriate treatment is very important to avoid the person from going blind, because once he loses vision, there is nothing that we can do. So how is glaucoma treated? The first is regular eye checkups to identify people who have glaucoma, and there is a large subset of people for whom we cannot say that you already have glaucoma, but we cannot say that you definitely do not have it either, and this group is called suspect. The number of suspects are many more. It is a much larger group than the patients who actually have glaucoma. Therefore, you can understand that all suspects do not develop glaucoma. But if you are a suspect, you have to keep on monitoring for glaucoma throughout your life. And if the appropriate signs develop, you may be started on treatment. The treatment for glaucoma, the first step is to know what type of glaucoma you have. If it is an open angle treatment, the first step is to give drops. If it is a narrow angle, the first step is to do a procedure called a laser iridotomy. It is not an invasive procedure. It is fairly simple to do and does not involve a lot of care to be taken after the procedure or before the procedure. Once an iridotomy is done, the doctor should check what is the outcome, and the further treatment after an iridotomy would also be with eye drops. Once the patient is started on eye drops, it may be 1 drop a day or it may be more, but he needs to put those drops as prescribed and preferably the same time every day. Sometimes eye drops don't work well enough, or patients are not able to tolerate the drops, or they have side effects to the drops, in which case you may have to go in for a surgery. What does the surgery do? These surgeries are known as filtration surgeries, in which an appropriate new passage is created for the fluid of the eye to drain out from the internal part and keep the pressure of the eye down. So these are called glaucoma filtering surgeries. And there are laser procedures which can also achieve a similar outcome. But again, I would like to say that whether it is eye drops, lasers, or filtration surgery, all have to be kept under monitor, because surgeries can stop functioning after some time. Lasers can also stop functioning after some time. And drops which are working well initially may start losing their effect as time goes. And only when you are being monitored appropriately, you will know, and the doctor will know, when more needs to be done to keep the disease under check. So the treatment of glaucoma depends on what type of glaucoma you have, and it could be eye drops, it could be a laser procedure, or it could be surgery. But the most important point is that glaucoma is a lifetime disease, and everything needs to be checked and monitored and kept going throughout the lifetime. Thank you.